Okay, well, there were many of both, and I'd have to say, in regards to challenges, the fact that it was high profile and very public, that was a challenge in itself, that it was political. The relationships between employers and DHS was also often challenging to manage, and what I mean by that is working within an agency, they're your employer, so for me it was Kildonan Uniting Care. However, working within the Victorian Bushfire Case Management Service, that was delivered by DHS. So really, it turned out that I had two kind of people to please at all times. I had Kildonan Uniting Care, who was my employer, but I also had DHS, who was overseeing the delivery of the Victorian Bushfire Case Management Service. There was also supervision, so in saying that, the supervision of staff, because as I mentioned previously, about 40% of our team were social workers. However, we had people come from all different areas, and that included health, business, finance, IT, and even some out of retirement, just to name a few. So that obviously posed some challenges in regards to supervision, because some of these workers had come from areas without the social work knowledge base, and they obviously had to be educated and trained and supervised, and also monitored and checked in with regularly to make sure that they were coping and managing okay. There was also the evolving service delivery model. So the Victorian Bushfire Case Management Service, because we'd never seen a disaster like Black Saturday, it was an evolving service model. Basically, it was put together, as a crisis response, and as time went on and more resources were put into it, it evolved, and this information, the resources were constantly disseminated to agencies and to staff, and so that was a challenge at times as well. There was also the fact that there was, as I mentioned before, time-limited funding. So, we had a team, like I said, of about 25, and every probably 6 to 7 months that changed, and then at the end, more quickly than that, every 3 months that changed, from going down to sort of 25 to 20 to 15 to 10 to 7 to 5, and then in the last 4 months it was just myself and 2 case managers until the end of February this year. There was also the issue of vicarious trauma, which I think is also really important to mention, which in terms of staff, so as a supervisor, supporting them to support their clients who obviously had been extremely traumatised and were suffering with various mental health issues, and how to manage, how to case managers manage that within their work with clients. So there was a lot of work done around vicarious trauma and boundaries and self-care with case managers. And what was rewarding? Well, there was plenty that was rewarding as well. I suppose the one that stands out is the ability to think outside the square, and we say that in social work and we say that in our practice, but sometimes we don't get the opportunity to do that, whereas we certainly did have the opportunity to work in a unique way in bushfire services. We also had the availability of resources, which was unique in itself, so we were able to access grants and material aid that wouldn't ordinarily be available in other service systems. We had the ability to inform service delivery, so when we identified needs that were happening within the communities with clients, we're able to feed that up to the higher levels of DHS and to VBAF, and that actually resulted in more grants and more releases of community agencies giving more material aid and financial assistance. We also had amazing client outcomes, such as tens of millions of dollars applied for and received in grants. We had hundreds of thousands of dollars of material aid applied for and received. We had hundreds of houses rebuilt. We had hundreds of people find permanent and temporary accommodation until they had rebuilt. We also had hundreds of referrals and linkages made to different services, including psychological, financial, legal, health, housing and other services. And we also had multiple partnerships forged and relationships that were made that will continue well into the future.
Well, I think the first one I touched on was just the multiple events that were occurring, both nationally and internationally, and trying to ensure that we coordinated an effective response to those. And secondly, leading and coordinating a workforce from across Australia. We drew our staff from across Australia with different professional backgrounds and blending those into a unified workforce that could hit the ground running pretty quickly, know and understand their role and be able to deliver the services that were expected of them in an extremely short time frame. The rewarding parts, I think, were the feedback that we got from our customer service staff and from our customers or the people that we were working with. They certainly weren't only Centrelink customers, who were genuinely appreciative of the assistance that we were able to provide or the support that we were able to provide to our staff, who were dealing with incredibly distressed people at times in a context that was very unfamiliar for them. And I think my summing up of whatever is the most rewarding part of involvement in these emergency responses is the humbling experience that you have when people in their very private pain are actually prepared to let you walk part of the journey with them.
The most challenging initially was that we were developing an enormous database and I needed a lot of help to try and pull that together. I guess the other thing was that we weren't really sure what information we needed from deployees to start with, so it was very much a learn-as-you-go sort of process, and I was always so worried that we would miss something that would be absolutely vital for people. So that was a bit of a challenge for me. Then I did start to get people coming in to assist with compiling the database, and I actually had at different times groups of 4 or 5 people assisting. It was such a lengthy process, and that was solely data entry. But for every person that you enter, you always have to make contact with them. You have to, as much as you can, you have to talk with them, find out their availabilities and that sort of thing. But you really can't do that with 600 people. So we had to try and identify key contacts in each of the districts. And that sometimes took a bit of time. Where I was fortunate was that we have a very good network of social work directors in hospitals across Queensland, and I was able very much to draw on the assistance of my colleagues. I'm also the chair of the Social Work Welfare and Social Work Associates Leadership Group for Queensland and have some really excellent social workers assisting me with that. So I was able to hand over my role there to Sue Cumming, who was of great assistance to me in keeping that part of my workload going. I suppose the other thing about it was that in finding the contacts in the districts, you made mistakes, bumbled around. Sometimes you lucked onto the right person, sometimes you didn't, then you had to apologise to 6 other people for going to the wrong person first of all, and so on and so on. So a huge amount of negotiation had to happen. But I, in some ways, actually found that really enjoyable too, because I was meeting and talking with people I would never have spoken to. CEOs from Mount Isa, for instance, and, people I probably would never, ever have had any contact with. So that actually, although it could be difficult, was not that the CEO from Mount Isa was difficult, they were absolutely wonderful. But it could be difficult at just trying to locate who was the person you needed to speak to. But I think that the most challenging thing was when we first started. We were evacuated one day, had to find somewhere to set up for the next day. We were moving in, and at the same time, I had a request to deploy more than 20 people as a first group through to Woomera and Lockyer. So I had to assist with the setting up, get all of my stuff in order so I could say, well, who are these people I'm going to try and get hold of? Who's the district contacts I have to get in touch with? And we had people walking in and out. There were IT people coming and going, computers being set up, phones ringing. Just a nightmare of activity. And in the middle of all of that, because the landlines were still being set up, I was having to do all of this on the mobile. So I'd be on the mobile finish a call, there'd be 6 others. So it was an incredibly hectic sort of time. But I did locate the 21 people. We did get them trained. Our psychologist stepped in and very quickly did some psychological first aid training with people on the go. We had to try and organise their transport and accommodation and so on, but fortunately the State Health Emergency Coordination Centre was assisting us with that. But even so, there was a huge amount of work to do around it. Then a lot of those people came from the Gold Coast, so we had to organise getting them down. Fortunately, the Gold Coast stepped in and hired a bus and got them down in a bus for us. Then we had to get them out to the airport, and it was a chaos, a nightmare of just activity everywhere. And then I suddenly realised that people probably didn't have a tetanus injection, so fortunately the emergency department of the hospital where we were sited at that stage, the Princess Alexandra Hospital, they stepped in. It was often very uncomfortable for our employees too. For instance, in Cairns, obviously there was no electricity after the cyclone. Generators were on in the motels where we had our people staying until about 11 o'clock, but then they went out and it was so hot people couldn't sleep, and after working 10, 12, 14-hour days, it was a very exhausting time for them. So by the end of their time there, they were literally spaced out